Healthcare is one of the most talked about issues among Canadians, yet there is no consensus on how to make our current healthcare system sustainable, and change is slow. PwC believes a topic this significant requires insight from an important group whose views don't usually get considered: everyday citizens. Over 3 weekends from April through June 2011, 28 randomly selected citizens from across Ontario volunteered to serve on the Citizens Reference Panel on Ontario Health Services. Facilitated by Mass LBP, a leading Canadian company dedicated to creating innovative public engagements, the citizens were tasked with 3 things: learn about the province's health system, understand the system's challenges, and consider choices to make sure we maintain quality, accessible, and publicly funded healthcare to all Ontarians.
I think I have this responsibility toward myself, toward my family and friends, to understand the healthcare system better, how it works, the challenges we're facing.
I don't know as much as I'd like to know about the healthcare system, and I think it's important to be informed about the community that you live in.
Moral obligation. I felt that if I get the call to do something like this, that it'd be an opportunity and a privilege actually to be a part of something like this. Once I read through and what this was about, that to me it's something that's important.
I have recently had experience, and my family members also had experience with the health system, and I wanted to know a bit more about it.
Throughout the 3 weekends, leaders from the healthcare community and Canadian universities presented different aspects of the healthcare system to help inform the citizens. During the final weekend, citizen panelists identified the top issues in our current healthcare system and options for reform that they believe best represent the will of Ontario people. These recommendations are being shared in a report with the healthcare community and governments across Canada.
Ontario may have particular health issues, but I think they are not so different from the issues that exist everywhere in Canada. We have quality problems, we have financial problems, we have calls for reform, we have concerns about wait times, and we have real questions about the sustainability of the systems. But I think we have more in common across the country than we have divisions about what the issues are.
Canadians feel very strongly about their healthcare system. It's something that we as Canadians help define our national characteristics. So I think if you're going to look at developing a sustainable system or make it more sustainable in the future, you absolutely have to include the citizens.
After going through the process, it became clear to the citizen panelists that there is a lot to learn about the significant issues facing our healthcare system sustainability.
I don't think the general public knows as much as we should know or be informed with, and this whole process has been an eye-opener for me.
I think we just know the basics, unless you've actually been a part of the healthcare system and needing a close family member or friend, or yourself having to use it. You don't really know the in-depth workings of the healthcare system.
So, what is the one message the Citizens Reference Panel would like to communicate to the healthcare community and government?
Fix communication. There's a problem of communication between the patient and the service providers, and between the service providers themselves.
I would really like the government and public health officials to really take it seriously. Really read into it, and I don't think we've made any suggestions that are unfeasible or radical in any way. It's stuff that can be implemented.
I believe that ultimately it will take political will on the part of the government to make the decisions to put these suggestions into effect to make it better. But it's definitely, we can find a solution to a lot of the problems that we're encountering.